Gentlemen, let's be honest with each other right from the start. Masturbation after 60 is normal. It's healthy and it's still an important part of your life. But here's the truth. The way you do it matters more now than it did when you were 20 or 30. That's the part nobody talks about, and that's exactly why I'm talking about it today. Some habits you carried from your younger years might no longer serve you, and in some cases they can actually cause discomfort or even health issues. My goal is not to shame you or tell you to stop. It's to show you how to keep this part of your life safe, satisfying, and sustainable. I'll break down the 3 most common mistakes men make after 60, mistakes I see again and again in my own patients, and I'll give you safer, smarter ways to avoid them. And here's what might surprise you: this conversation isn't just about pleasure. It's about your prostate comfort, your long-term well-being, and protecting your health, so you can keep enjoying intimacy with yourself or with a partner for many years to come. Before I explain how to do it right, let's build a foundation. We need to look at the real benefits masturbation still brings after 60 and the very real changes aging introduces. The first thing I want to acknowledge is that there are benefits here, benefits that don't vanish with age. Regular ejaculation can help you feel more comfortable in your pelvis, and there's some evidence, although mixed, that it may support fluid turnover in the prostate. At the very least, many men report that it helps reduce pelvic heaviness or discomfort. And on top of that, it's one of the most reliable ways to release stress, something we all need in our later years. But there's another side to the story. Our bodies change with age, and none of us can avoid that. Skin gets drier, tissues lose some of their natural elasticity, and sensations shift. What felt effortless in your 40s may not feel the same at 70. This doesn't mean something is wrong, it just means your technique has to evolve along with your body. And that's where so many men stumble. They keep doing things the old way, assuming what worked before will still work now. The danger is subtle. Even if you think you're being gentle, those old habits can create micro-injuries in tissue that's no longer as resilient as it once was. That's why how you engage matters so much more than whether you do it at all. And this is exactly why I want to take you through the 3 mistakes I see most often in the clinic, because avoiding them makes all the difference. The first mistake, and the one I see more than any other, is neglecting lubrication. Too many men after 60 think they can skip it, or they grab whatever's nearby, without realizing the consequences. The problem is simple: when your dry, friction builds up fast. That friction doesn't just cause short-term irritation, it can create tiny injuries in penile tissue, and over time those micro-tears can contribute to conditions like Peyronie's disease, where the penis develops painful curvature. The safe solution couldn't be clearer. Always reach for a high-quality lubricant, and don't be stingy with it. Water-based lubricants are safe, easy to clean, and compatible with most situations. If you tend to have drier skin or enjoy longer sessions, silicone-based options last longer and provide smoother glide, though you should avoid them with silicone toys. And remember, oil-based lubricants are never safe to use with latex condoms because they degrade the material. Apply generously and reapply whenever things start to feel less smooth. Think of lube not as an optional extra, but as essential protection for some of the most sensitive tissue you have. But here's the twist: even with perfect lubrication, another mistake can undo all that protection. It's not just about what you use, it's about how much force you apply. This is where many men go wrong. They assume that more force equals more sensation. But after 60, that old belief is not only outdated, it's dangerous. When you squeeze too tightly, stroke too aggressively, or bend in ways the penis isn't meant to bend, you're placing tremendous stress on delicate erectile tissue, on fragile blood vessels, and on the nerves that carry sensation. The result? Bruising, lingering numbness, even a long-term reduction in sensation that doesn't bounce back the way it once did. And here's the irony: the harder you go, the more likely you are to actually dull the very pleasure you're chasing. The safer, smarter alternative is to slow down and become more mindful. Use steady, rhythmic motions rather than brute force. Let the sensation build naturally instead of trying to force it. And always listen to your body. If anything feels off, pain, burning, or just something unusual, that's not a signal to push through, that's a signal to stop immediately. The good news is when men make this adjustment, they often rediscover pleasure they thought was gone because they're no longer numbing their own sensitivity. But there's still one more mistake, one that hides in plain sight and shows up after you think you're done. This final mistake might sound trivial, but it makes a world of difference: skipping hygiene after ejaculation. I can't stress enough how important this is, especially as we age. When fluid is left on the skin mixed with warmth and moisture, it creates the perfect breeding ground for bacteria. For men with an enlarged prostate or diabetes, the risk is even higher. Urinary tract infections, skin irritation, or lingering discomfort can all start from something as simple as not washing. The fix is straightforward: always wash your penis and surrounding area with warm water afterward. If you choose to use a cleanser, make sure it's pH balanced, fragrance-free, and made for sensitive skin. Harsh soaps do more harm than good. And once you're done, dry thoroughly, not roughly, just enough to keep the skin free from lingering moisture. This 2-minute routine can save you weeks of dealing with infection or irritation, and it's one of the simplest forms of self-care you can practice. So while it may seem like a small detail, it's actually a cornerstone of protecting your long-term comfort and function. And that brings us to the bigger picture: why these little adjustments, lube, gentleness, hygiene, matter far beyond the moment itself, shaping your sexual health for years to come. What might feel like a small adjustment in your daily routine actually adds up to enormous benefits over the long run. Every time you protect your tissues with good lubrication, avoid unnecessary force, and clean up properly afterward, you're doing far more than just preventing short-term irritation. You're actively supporting better blood flow, keeping those tiny blood vessels supple and responsive, and preserving the health of the nerves that carry sensation. Over time, these little acts of care accumulate the way small deposits grow in a savings account. They protect you from the kinds of micro-injuries that slowly chip away at sensitivity, they lower your chances of infection that could become chronic, and they keep the mechanics of your sexual health working smoothly. And here's the part that often surprises men: the choices you make today directly shape your ability to feel pleasure years from now. Neglect breeds problems, but small protective habits now safeguard your confidence and comfort later. That's why I say this isn't just maintenance, it's an investment. To make it simple, I want to boil these lessons down into a practical checklist you can use every single time. Let me put it plainly: you don't need a textbook to remember the essentials, just a simple 4-point checklist. First, always listen to your body. If you feel pain, discomfort, or anything unusual, don't ignore it. That's your body speaking clearly. Second, be flexible enough to adjust your technique. As we age, what feels good can shift, and trying something new may actually bring back sensations you thought were gone. Third, let go of the idea that there's a right number of times you should masturbate. Frequency is personal, and the only correct amount is what feels comfortable and fulfilling for you. Fourth, hygiene is non-negotiable before and especially after. Take those few minutes to protect yourself, and it pays off in spades. Now here's the twist. If you follow all 4 points and still find that things aren't right, maybe there's lingering pain or your erections aren't as reliable as they used to be, that's not something to push through on your own. That's your signal to get help. Which leads me directly to the question of when to put pride aside and see a doctor. This is where I draw a firm line, because no matter how independent you are, there are moments when professional care is essential. Everything I've shared so far is about safe practice, but it's not a substitute for medical advice. If you ever notice persistent pain that doesn't fade, bleeding of any kind, unusual discharge, a sudden loss of sensation, or difficulty achieving or maintaining an erection that goes on, those are red flags. And if something simply doesn't feel right to you, that's reason enough to get checked. Early detection is your best ally, because many problems, when caught early, can be treated completely and leave no lasting damage. The real risk isn't in seeking help, it's in waiting too long and letting something small grow into something far more serious. So think of medical care as another layer of protection, not as a last resort. By being proactive, you not only prevent problems from worsening, you also give yourself peace of mind. And with that reassurance, we can wrap this up by stepping back and looking at the bigger picture: how to hold on to your confidence and your spark moving forward. At the end of the day, I want you to leave this conversation with clarity and confidence. Masturbation after 60 is not something to feel ashamed of. It's a natural, healthy part of life, and when you do it correctly, it supports your comfort, your prostate health, and your overall well-being. Remember the 3 mistakes to avoid skipping lubrication, using excessive force, and neglecting hygiene. Balance those with the 4 practices to adopt: listening to your body, adjusting your technique, setting your own rhythm, and cleaning up carefully. That simple framework allows you to maintain a fulfilling sexual life for decades without fear and without unnecessary complications. Here's the part that often surprises men: losing desire or struggling with sensitivity is rarely just because of age. More often, it's the accumulation of small habits that either help you thrive or hold you back. Change the habits and you can change the outcome. So take this knowledge as a tool, not just information. Put it into practice, protect yourself, and embrace the confidence that comes with knowing you're in control of your own well-being. And if you're wondering about the next step, stay with me. In my upcoming video, I'll tackle another sensitive but crucial topic: why libido sometimes drops after 60, what's normal, and what you can do to reignite your spark naturally. You won't want to miss it. Until then, take care of yourself, stay proactive, and keep building the foundation for a long, healthy, and satisfying life. Gentlemen, let me leave you with this final thought. Taking care of your sexual health after 60 isn't about restriction, it's about freedom. The freedom to keep enjoying pleasure without pain, without worry, and with the confidence that you're protecting yourself for the long run. By avoiding the 3 mistakes we've discussed and embracing the simple habits that safeguard your body, you're giving yourself the gift of longevity, comfort, and satisfaction. If this conversation has helped you, I want you to stay connected so you don't miss what comes next. Go ahead and hit that subscribe button right now, turn on the bell notification, and join a community of men committed to staying healthy, informed, and in control of their well-being. Share your thoughts in the comments, ask your questions, and let's keep this dialogue going. Because the more you know, the better you live. Stay strong, stay healthy, and I'll see you in the next video.